What's up? Just when you guys thought you got rid of me from A&P, here I am back. Thanks to the wonderful world of modern technology, you get to see me on video today. So, today is Monday for you all, and Tuesday we will start Sims Lab. So some of you will have it on Tuesday and some of you have it on Wednesday. The purpose of this short video is to kind of give you the tools that you need to successfully get through Sims Lab the next day or two. So, and the action that I'm trying to put in place here is to kind of give you guys the concept of what expectations and plan of action you should have when you are out in the hospital or in your clinical facilities throughout. So, since this is a clinical Sims day, it's a clinical day, so proper attire, your scrubs, stethoscope, pen light, scissors, everything that you take out clinically is required. Don't forget your name badge, okay? When you show up for clinicals, clinical time starts at 7:30. You need to be ready to start at 7:30. It's not get there at 7:30. You should be ready to go on the floor and get to work and start learning, okay? So what I'd like to start with in Sims Lab, the first things that we need to take into consideration is nurses under the Practice Act. It's the duty of a nurse and one of the bylaws that we do no harm. So everything that we do as far as a nurse is we make sure that safety is a priority in our care, okay? So we'll start out with our ADET. You guys need to refresh on your ADET, okay? Your assessment skills from head to toe. Make sure that you have a full understanding of that. Your patient identifiers, 7 rights. A big one, wash your hands. So y'all need to be practicing that anytime you come in and out a door. Wash those hands in and out, scrub in and out, okay? Number one risk to spread an infection is not washing our hands, so we can wash our hands and prevent that and do no harm, and we stay in compliance with our nursing bylaws, okay? So you will start out with a case study. All of our nursing history, nursing applications, nursing interventions, when we call a doc, whatever we do, we kind of go off a reference called a SBAR, which is Situation, Background, Assessment, and Recommendation, okay? So if you need to refresh on that, or if you've not had any training on that, Google it. It's okay to Google it. Google SBAR and kind of get an understanding for it, okay? So when we start out in your Sims Lab, you will have a case study, which will have your situation here, and it's going to have the background of the patient, okay? And then you'll start out from there, and you will do your physical assessment, okay? Front and back of all the body systems, all right? Then we're also going to include a Morris Fall Scale and a Braden Risk Skin Assessment Scale. You may not have been introduced to them yet, but you will be by the ends of Sims if you have not. But it's something that all the hospitals do, and it's something that's very important to protect our patients, okay? So make sure when you enter the room, you knock, you acknowledge, you wash your hands, you introduce, you do your duration, explanation, you thank. When you're doing your head-to-toe assessment, don't forget there's an environmental assessment that goes with that. The way that I like to do it is once I get my hands washed and I introduce and acknowledge and I verify 2 identifiers, and I've already looked at his history and physical and the situation and background, him or her, then I'll do my head to toe, and once I get that out, I will go from the patient outwards. You know, check your IV spot, make sure it's in date, check your tubing, check your fluids that are hanging, make sure it's the right rate, make sure there's no environmental factors or hazards where the patient could trip or fall. If your patient has precursors such as seizure disorders, that we have the proper safety tools in place to safeguard them from hurting themselves and that type of stuff. So it's going to be a fun time. It's going to be a good time. Don't stress about it. This will be probably the easiest Sims Lab that you have. I'm not really worried that you have an understanding for the pathophysiology behind what's going on with our patient. More of we're going to learn how to gather the information. So once we get through all that, you've probably heard me say it maybe once. I'm not for sure if I even mentioned it, but we're going to concept map. Okay, we're going to take everything that's within normal limits and without normal limits, and we're going to start piecing it together. Okay, that's a big piece of the puzzle. And all of this stuff that you've learned in class is time to start applying in the field. So this is a good way to kind of sharpen your skills on that. So it's Sims Lab time. It's a good time. Can we get a woot woot? We'll see you tomorrow.